More than a year after public hearings around the country were concluded, the committee is now dealing with oral submissions on the NHI Bill. First up, the SA Nursing Council, which told MPs the bulk of NHI services will be provided to the public by nurses.
We see ourselves providing information because we are the custodian of the register for nurses, providing information to the National Department of Health in respect of the numbers of nurses, in respect of the categories of nurses, and specifically in respect of the specialist nurses that we have got in the register, especially those that will play a critical role at primary health care.
Next up, the Pharmacy Council, who pleaded with MPs not to be excluded from the bill.
Primary health care cannot be defined in any way without mentioning and or talking to pharmacy as the core or the main part of the primary health care.
The Health Professionals Council said under the NHI, medical aid schemes will need to be replaced.
For NHI to work, there should be only one funding mechanism for health in the Republic in South Africa. And it's an essential requisite for establishing, and it should be clear pronouncement, that it replaces all funding mechanism for health. That should be the message that we're putting very clear to your committee, honorables. It is clear that, and it must be clear that NHI should be taking over from the medical schemes, and all assets that sit under medical scheme must be transferred to NHI.
Professor Nemutandani said the NHI Bill should replace the Medical Aid Act. However, presenters from the Board of Healthcare Funders countered this argument, saying there is a role for medical aid schemes. Submissions will continue this week. Abra Barbia, SABC News, Parliament.